Well, it's been a year since the COVID pandemic started, and boy, oh boy, what a year it has been.
Yeah, at this time last year, most of us were at home, and that would include Bryan Mills, who was homesick with the virus and running a hospital system at the same time.
So today we reflect on the conversation we had with Bryan Mills 1 year ago, and we talk about what we've learned ever since. Bryan Mills is president and CEO of Community Health Network. It's one of the largest hospital systems in the state of Indiana. Community last year recorded the state's first case of COVID-19.
We've come a long way from the first patient testing positive in the state of Indiana being met in your parking lot overnight.
The message that we could take home for all of you is this is the beginning and this is real.
After that, Community also reported Indiana's first COVID death. COVID-19 now has claimed its first victim here. This as Mills himself tested positive for the coronavirus. He quarantined for weeks and kept working from his basement.
It's good to see you.
Nice to see you.
It's now a year later, and he's recovered.
I'm good, by and large. I mean, I'm back normal. I still can't taste or smell. I'm still hopeful that my antibodies will be able to help somebody else.
He went on last summer to donate plasma to help those who are still sick. Now he's back in the office. And compared to his analogy from a year ago,
if this is for a football game, we're in the first quarter, and people don't like hearing that.
Let's just stop right there. If this is a football game now in March of 2021, where are we?
Well, first of all, I would say I wish I was wrong. I wish when I said it was first quarter, it wasn't, but it was. Everybody wants this, it's all clear. And they see the vaccines and they say, well, can we go do this or not? I'm still cautious. I mean, I think we're in the second half, but I don't think I think if we don't still take this seriously, you and I are in this with no mask, we're here with mask. That's pretty telling.
So too are the numbers. 500 community staffers in quarantine then compared to now.
So, but when you talk about 500 staff members quarantined, that's a big number. I mean, can you remember back to that time?
Yeah, and it is a big number. And when you think about, we're constantly short-staffed anyway. And then, so you're trying to treat all these people, and we've got to find ways to do it.
Fortunately, hospitalizations then to now are down dramatically.
At peak on a hospitalization, we would have been around 250, 275. Now we're in the teens.
While Community repurposed and retrained nearly 2,000 workers, in June, it reduced its workforce by 80 positions, mostly administrative.
What are you worried about?
Biggest worry, I've told my senior team and my board, is that when we finally get through this, I'm concerned that we've got all these people that are just going to be burned out. They've come, like soldiers every day and said, I'm here to do it, I do my job. I'm worried that when it's all said and done, I need a break. I need to go do something else. And I think we're going to have to find ways to wrap our arms around people to give them an opportunity to do that, but we need them to provide health care. I worry about people being scared of the healthcare system so they don't do their preventive, they don't get their preventive things. I'm worried about what happens down the road doing that. And I see us wearing masks and taking these other precautions for many, many months.
And Mills went on to say he knows that wearing masks for months to come is not what we want to hear right now, but he believes that more months of masks really is likely. Scott.